You know, the human body has this incredible built-in blueprint for childbirth, but sometimes it just needs a little nudge to get things going. Today, we're diving into the science behind that nudge, a really powerful drug called Dinoprostone. Think of it as a synthetic copy of a natural process, one that's designed to help kickstart one of the most amazing events in life.
So, here's our game plan. First, we'll look at what this drug actually is, this natural impersonator. Then we'll break down its two-step process. After that, we'll get into the clinical toolkit, see when it's used, and how doctors choose the right form. And we'll wrap up with the most important part, safety first, digging into all the rules and risks.
All right, let's jump right in. Section 1, a natural impersonator. So what in the world is Dinoprostone? Okay, at its very core, Dinoprostone is a lab-made version of a natural substance called Prostaglandin E2, or PGE2. Our bodies make PGE2 on their own. It's like a local messenger that basically yells, okay, it's go time for childbirth. So Dinoprostone is just a synthetic key that's been perfectly crafted to fit that very same lock. Now, pay close attention to this. It's classified as a high-alert drug. This is a big deal. It's not something you just go pick up at the pharmacy. It's incredibly potent, prescription only, and it's only used in a hospital. Why? Because its power to start labor means you need constant, careful supervision to keep both mom and baby safe.
All right, Section 2, a two-step process. So we know it's a powerful mimic, but how does it actually get the job done? Well, it has a dual mission. Think of it as a 1-2 punch for starting labor. And here's that dual mission, plain and simple. First, its job is to prepare the path. It does this by ripening the cervix, basically turning a rigid closed gateway into a soft open curtain. Then, once that path is ready, it moves on to its second job, start the push. This is where it gets the uterus to actually start contracting.
So, how exactly does it prepare the path? I mean, what does ripening even mean? Well, it's a three-part chemical makeover. First, it helps break down the tough collagen fibers that keep the cervix firm. Then it pulls in more water to make the whole area softer and more flexible. And finally, it helps the smooth muscles relax. It's a total transformation that gets the cervix ready for delivery.
Okay, so the cervix is ready to go. Now, Dinoprostone switches to its second task. It latches onto receptors on the uterine muscle, and that triggers a chemical signal that tells the muscle, all right, time to start squeezing. This is the spark that ignites those powerful, rhythmic contractions of labor. So we know what it is, and we know how it works. That brings us to Section 3, the clinical toolkit. In what situations do doctors look at their options and say, yep, this is the right tool for the job?
By far, its #1 job is cervical ripening, when labor has to be induced for a medical reason, but the body isn't quite on board yet. And sometimes just that ripening process is enough to kick labor into gear all on its own. But it has other really specific uses too, like inducing contractions for a second trimester termination or helping to manage a missed abortion. And here's an interesting one. It can even be used off-label to stop severe bleeding after birth because it's so good at making the uterus contract.
This all leads to a really practical question. Section 4, choosing the form. How is this stuff actually administered? Because the delivery method is absolutely key to controlling its powerful effects. Okay, so the two main forms show two totally different strategies. You've got the vaginal insert, which is kind of like a set-it-and-forget-it system. It's a little device that releases the drug slowly and steadily over 12 hours. Great for a gentle start. And here's the brilliant part. It has a retrieval string, so if things get too intense, the nurse can just pull it out immediately. Then you have the gel. This gives doctors more control with incremental dosing. They apply a dose, wait and see, and can add more later if needed. It's all about making adjustments on the fly.
Now there is a third option, an IV infusion, but wow, this one is reserved almost exclusively for very serious situations like second trimester terminations. Because it's going directly into the bloodstream, it requires an even higher, more intense level of monitoring. And that need for intense monitoring brings us to our final, and honestly, our most critical section. Section 5, safety first. Let's really dig into what makes Dinoprostone a high-alert drug.
This quote really just says it all. Its power necessitates rigorous patient selection, continuous monitoring, and readiness to manage potential complications. The whole process is built around respecting just how potent this drug is. It's not just about giving the medication, it's about building this entire fortress of safety protocols around its use.
And that safety fortress starts with patient selection. It's the absolute first line of defense. There are situations where dinoprostone is strictly off-limits. For instance, if someone's had a major uterine surgery before, like a classical C-section, the risk of rupture is just too high. It's also a no-go if the placenta is blocking the cervix, if there's any unexplained bleeding, or if the baby is already showing signs of distress.
Now, even with super careful selection, side effects can happen. For the mother, things like nausea or a fever are pretty common. Prostaglandins affect lots of body systems. But the serious risk is something called uterine hyperstimulation. That's a fancy way of saying the contractions get way too frequent or way too strong. And that, right there, is the main risk for the baby. Those intense contractions can squeeze the umbilical cord, reduce blood flow, and lead to fetal distress.
And that is why continuous monitoring is completely non-negotiable. It's a three-part protocol running at all times. First, you've got electronic monitoring of the baby's heart rate, looking for any sign of trouble. Second, you're constantly watching the uterus itself. How often, how long, how strong are those contractions? And third, you're regularly checking the mother's vital signs. This constant vigilance lets the medical team spot a problem the very second it starts.
So, when you put it all together, dinoprostone is an absolutely critical tool in modern obstetrics. It's an incredible piece of science that mimics a natural process to help start labor when it's medically necessary. But its sheer power demands constant vigilance and a whole lot of respect from the clinical teams who use it.
And that really brings us to the core issue, doesn't it? Dinoprostone is a powerful mimic of nature, which leaves us with a really important question to think about. As we get better and better at supporting these profound biological processes, how do we make sure that our copy never becomes more powerful than the original?